Now let's turn to Omicron and the rising wave of cases around the U.S. The new variant is driving a surge in the U.S. Omicron is now present in all 50 states, just 3 weeks after it was first detected here. Stephanie Sy begins our coverage.
In Washington, D.C., residents waited in line to get a free COVID-19 testing kit in preparation for holiday travel. As the highly transmissible Omicron COVID variant surges,
no, it's just one box per person.
Demand for testing is high around the country. Pharmacies are quickly selling out of at-home tests, and testing sites in big cities like New York have hours-long wait times. The White House said today it's finalizing plans to secure 500 million at-home rapid tests to distribute for free. In an exclusive interview with President Biden yesterday, ABC's World News Tonight anchor David Muir asked why those kits weren't ordered sooner.
If you go to the pharmacy, we hear this over and over again, empty shelves, no test kits. Is that a failure?
No, I don't think it's a failure. I think it's, you could argue that we should have known a year ago, 6 months ago, 2 months ago, a month ago.
We're nearly 2 years into this pandemic. You're a year into the presidency. Empty shelves and no test kits in some places, 3 days before Christmas when it's so important. Is that good enough?
No, nothing's been good enough.
For months before Omicron emerged, President Biden pledged to make at-home COVID tests more easily available. He made this statement in September.
We're committing $2 billion to purchase nearly 300 million rapid tests for distribution to community health centers, food banks, schools, so that every American, no matter their income, can access free and convenient tests.
In the ABC interview, the president said no one could have predicted Omicron and said fully vaccinated and tested Americans should still feel safe to gather.
If you are tested, if you know where you are in terms of having gotten the shots, there's no reason why you can't get together with your family and your friends. We couldn't do that last Christmas.
Meanwhile, another treatment option for high-risk COVID patients is on the horizon. The FDA today authorized the country's second antiviral pill to treat COVID-19 at home, just 1 day after Pfizer's Paxlovid was approved. Molnupiravir cuts COVID hospitalizations and deaths by 30% in those at higher risk of developing severe disease. Merck said it will have 10 million treatment packs available by the end of this month, and the White House plans to ship 3 million to states by the end of January. At busy airports today, many holiday travelers were undeterred by the wave of new cases.
We're both vaccinated fully and have been since we could be, and so we follow all the protocols and feel pretty safe.
But many Americans who have tested positive have seen the pandemic upend their holiday plans for yet another year.
If I test positive, I'm just staying in town, not visiting family. So fingers crossed that it's a negative test.
New infections have reached over 168,000 per day, surpassing this summer's peak. 7,800 people are being hospitalized each day, straining hospitals in the hard-hit Midwest and New England. And more than 1,300 Americans are still dying each day, a slight increase from previous weeks. Most of those deaths are attributed to the Delta variant. Cases are only expected to rise in coming weeks. For the PBS NewsHour, I'm Stephanie Sy.
There are so many questions about the transmissibility of this variant, its severity, and testing availability that is lacking, particularly when compared to the demand. Catherine Wu is a staff writer for The Atlantic, where she covers science. Catherine Wu, welcome to the NewsHour. Clearly, this is just still a very difficult time for Americans just on the cusp of a holiday. Explain to us how this wave with Omicron is different from what we've already seen in this pandemic.
Absolutely. I think the biggest thing to point out here is just that this feels like a wave on fast forward. We're seeing case rates doubling at astounding rates. We're seeing so many people test positive. And I think one of the most concerning things about this particular wave is Omicron has found a much larger susceptible population than Delta did just a few months ago. We know that vaccinated people are far better protected than those who are unvaccinated against this variant, but it's clear that Omicron can still move fast enough and and dodge some immune defenses, that it can still infect those vaccinated people and spread out of them. That means it's really just got a lot more room to move around through populations, and we're seeing the effects of that now. The big concern here is that we are going to see a big wave of cases and possibly enough hospitalizations to overwhelm healthcare systems.
And so reason to worry for those who are vaccinated and boosted, because clearly we are susceptible too. But we also read, Catherine Wu, that cases may be milder than previous variants. What do we know about that?
Yeah, so this is a really interesting collision between virus and vaccine right now. I think, the first thing to know is that, again, it's not useful to talk about this variant in binary terms, safe or unsafe. Vaccinated people, especially vaccinated and boosted people, are going to be much safer. We know that even though this variant can dodge some of the defenses that vaccinated bodies mount, it's not going to overcome all of them. And that especially means that vaccinated people are especially going to be well protected against more severe forms of disease. And, maybe we are seeing that already play out. The world has so much more immunity than it did a couple years ago. We have progressed so far in such little time. And it is early days still. Remember that it takes a couple weeks for hospitalization data to really manifest. And this variant has really only been in the global conversation for about a month. But we are seeing encouraging signs that case rates are not dragging hospitalization rates in quite the lockstep that they were before. If that continues to pan out, that could be a good sign. It's not, game over for the pandemic. A small percentage of hospitalizations can still be devastating because a small percentage of a big number can still be a huge number, but it is encouraging. I think what's complicated here is when we say mild, that's disease, and disease is an interaction between host and pathogen. Is it because we as hosts are better defended, so it's milder, or is it because the virus is intrinsically less deadly? It could be both, and that's really difficult to untangle, so people shouldn't take that mild for granted.
It's an important message. You and your co-authors have a new piece in The Atlantic today where you say, among other things, you say, we keep making the same pandemic mistakes over and over again. Of course, one of the mistakes critics are pointing to has to do with lack of available and easily accessible testing. Just how far behind is the United States from where we should be with regard to testing?
We are very, very far behind. And I think this has been a mistake that we really have been repeating since almost day one. It took the country a very long time to bring tests online to any measurable degree, and we've really been playing catch up ever since. We've seen other countries roll out very successfully, free testing programs, widely available testing programs, whether it's, laboratory tests that use PCR or these home tests that some people can buy for $1 or even get for free in other countries. Here in the US, we're making steps toward having freely available tests, but that's going to take months to kick in. Or we're being asked to reimburse tests, and that is a very cumbersome and limited process. We are nowhere near flush enough with tests as we need to be. The Biden administration's plan to roll out 500 million free ones, that sounds like a lot, but also remember that there are 330 million people in this country. That's less than 2 tests per person.
And we've been thinking about that this week. And I think one question is, was it realistic for the administration to have, I don't know, had manufactured billions of tests? Because you're right, 330 million Americans, multiple tests that we're told we need to be taking whenever we're about to gather. It's a conundrum.
It definitely is. And I think the tricky thing is, we also have to strike this balance for people who are able to access those tests. Those are vital tools, but we also have to be humble in the face of a variant that moves this quickly. A test that's negative in the morning might not hold true by the afternoon. If the virus is spreading really quickly outside our bodies, it might be moving at quite a rapid clip inside our bodies as well.
All the more reason why we need more and more tests. And as you say, more than what we have available. So many questions still. Catherine Wu, thank you so much for your insights. We appreciate it.
Thank you so much for having me.